Hi, I'm Dr. Tony Windebank. I'm a neurologist at the Mayo Clinic in Rochester, Minnesota, and I'm here at the World Stem Cell Summit with Dr. Nathan Staff, who is also a neurologist at Mayo. And we wanted to talk a little bit about our clinical trial that we're carrying out using stem cells to treat Lou Gehrig's disease. Lou Gehrig's disease is a terrible condition that results in progressive loss of muscle strength and, for many people, eventually difficulty breathing, difficulty swallowing and speaking. And unfortunately, the average survival for this terrible disease is only about 3 years. And again, unfortunately, there's no treatment for this. There's been a huge amount of research done all over the world into the cause and possible treatments for Lou Gehrig's disease, going right back to Lou Gehrig's time, 70 years ago. But as I said, there is no treatment. Many drugs have been tried in clinical trials and unfortunately haven't been shown to work. What we are now thinking about and working on is the possible use of stem cells to treat Lou Gehrig's disease. There are several kinds of stem cells, and the ones that we're working with are ones that we can get directly from the patient, isolate stem cells, and then put them back into the patient to hope that they'll help with this disease. Now, it's very important to stress that what we're doing is a safety study. So we're trying to find out what kind of doses will work with patients, and is it safe to actually inject stem cells by a spinal tap into a patient. And my colleague Dr. Staff is going to tell you a little bit more about the study.
Thank you. So we've been working very closely with the FDA and our Institutional Review Board to develop this safety study for stem cells in Lou Gehrig's disease. And essentially the way it's being performed is that we're taking a small bit of fat from patients, and it's being processed in our cell laboratory, grown up, and then patients come back roughly 2 months later and have their stem cells injected into their spinal fluid. They stay in the hospital for roughly 3 days, and they're monitored very closely to make sure there aren't any ill effects. Again, the plan at this point is to just be looking at the safety profile of how this drug works, and then we're going to increase the dose over time to make sure that it works at even higher doses.
So one of the things, again, that's very important to emphasize is that this is a safety study. It's being done under close cooperation with the FDA. And then also, what's important is that as this research moves forward, the type of technology that's being used in terms of isolating and preparing the stem cells is quite straightforward. So we again want to emphasize that although it may not be possible for a lot of patients with Lou Gehrig's disease to enter this study, if positive results start to appear, the technology to share this with other hospitals and medical centers will be very straightforward.